Italy's death toll now topping China's. But out of China, what appears to be some encouraging news. Here's Richard Engel.
With many European countries now on wartime footing, a haunting image today. The Italian military escorting coffins of COVID-19 victims out of the hard-hit city of Bergamo. Italy overtaking China as the country with the most coronavirus-related deaths. Italian newspapers are filled with pages and pages of obituaries. American tourists in Italy saying this could be coming to the U.S.
It's hard to imagine New York looking like this, but it was hard to imagine Rome looking like this before it happened.
Yeah.
But finally, some good news tonight that the virus can be tamed, if not beaten. If China is to be believed, it has no new domestic infections for the first time. But the cost is freedom. The one-party state locked down tens of millions. Disobedience wasn't an option. I spoke with Neil Ferguson, one of the UK's top epidemiologists. Does the United States need to go like what China did?
Unless you roll out testing on a massive scale and innovative approaches to contact tracing and isolation of cases, which the Chinese are now doing, then you really have no choice but to really lock down the country.
Today, he tested positive for the virus. Richard Engel, NBC News, London.
Here at home, as the coronavirus spreads, there are growing concerns for Americans in rural communities. Our Stephanie Gosk reports.
Far from the densely populated cities, rural America may seem better protected from the coronavirus. But health officials say it is a matter of time before it spreads everywhere, and people here could be especially vulnerable.
You are dealing with a demographic that could be the hardest hit by this virus, aren't you?
We are.
The rural population in the U.S. tends to be older and generally less healthy than people in the cities, while the number of hospitals providing services is dwindling. 126 have closed in the last decade, 6 so far this year, and now a pandemic.
If you can imagine a huge tidal wave, and we feel like we're in the shadow, and we're waiting for the wave to hit.
Steve Kelly runs Ellenville Regional Hospital in New York's Catskill Mountains, where they've been working around the clock to prepare.
This is a triage station that is set up for patients that have flu symptoms.
His facility has 25 beds for 28,000 people. A neighboring county has already asked visitors to stay away.
How many ventilators do you have?
We only have one ventilator.
One ventilator. So you can have one patient who needs a ventilator, and then what do you do after that?
We transfer that patient.
It's the same situation at Holton Community Hospital in Kansas, where they already are reusing protective gear.
It's very scary. In rural America, staff wear a lot of different hats. Just take my safety officer. She's my infection control nurse. She's my safety officer. She also is my employee health nurse.
A hospital in Oklahoma is seeing respiratory problems, but has no tests. One in Wisconsin running out of swabs and masks. Another in Indiana worried about money. The National Rural Health Association's warning. The rural healthcare safety net was already fragile. Now it's being crippled by COVID-19. Stephanie Gosk, NBC News, Ellenville, New York.
And with all this fear, the feds are warning scammers are cashing in. NBC's Pete Williams and what to watch out for.
Want to know where the coronavirus hotspots are? This app for Android phones claims to provide real-time information. But internet researchers say when downloaded, it locks your phone and asks for a ransom in bitcoins to unlock it. The FDA and Federal Trade Commission warned 7 companies to stop claiming that their products, including teas and essential oils, can treat the virus. Now a phone scam claims to take reservations for a vaccine.
Pre-booking vaccine for coronavirus health center.
A prosecutor in Virginia is helping lead the federal government's effort to crack down.
We're worried about seniors because they are a vulnerable population, both to this virus as well as to scams.
Among the known scams, fake websites offering to sell medical supplies now in high demand, like surgical masks, phony charities seeking donations, offers to invest in companies claiming they can detect or cure the virus, and even calls or emails pretending to be from doctors who claim to be treating a relative and demanding payment.
Just don't know that you can commit a more ruthless and evil act right now.
His advice: ignore claims of a treatment, there isn't one yet, give only to known charities, and don't fall for someone claiming to be a doctor asking for money. Lester?
It's pretty awful. Pete, thank you. Up next, how to safely handle your home deliveries.